Welcome to Health Source of Fargo, North Dakota. Today's topic, bone injuries, compound and simple fractures. Bone injuries are a painful but common occurrence. Most people will suffer one or two broken bones known as fractures. The two major categories are compound and simple. Let me tell you how they differ and how they're treated. Description of types of bone fractures. In a compound fracture, one or more pieces of broken bone protrude through the skin. In a simple fracture, the bone remains in its place. Simple fractures can be divided into several types. A few of these are named for the direction of the break within the bone. Transverse, the fracture runs across the width of the bone. Oblique, the fracture runs diagonally across the length of the bone. Spiral, the fracture runs diagonally around the bone. Green stick, the bone bends or fractures only partially, usually in children's bones. Three other types of simple fractures are based on the result of the fracture. Impacted, one piece of the bone is driven into another piece. Avulsion, a small piece of bone is torn away from the main bone. Comminuted, the damaged area has suffered multiple small fractures. A stress fracture is a small crack in the bone. Refer to the article titled Bone Injuries, Stress Fractures. Symptoms of a bone injury. Although you can't see a simple fracture, there are a variety of symptoms. Check for pain and swelling around the injured area. You may see bruises from internal bleeding, pressure, weight, or simple movements involving the injured part that may cause severe pain. Finally, the tissues near or below the injured area may feel numb or be paralyzed since the injury may be restricting blood flow. Diagnosis of a fracture. An X-ray is the primary tool for determining whether you've suffered a simple fracture and what type. In some cases, X-rays are not conclusive. Your doctor will then likely order a bone scan or a magnetic resonance imaging test, MRI. Compound fractures may require lab tests to determine the amount of blood loss and whether infection has set in. Treatment of a fracture. The primary treatment of a fracture is immobilization. This prevents further damage and enables healing. The doctor may use a brace, splint, cast, sling, or a combination of these. A cast is typically not applied until all swelling has receded. For compound or severe simple fractures, surgery may be required. A variety of devices keep the bone securely in place, such as plates, screws, and rods. In some cases, a bone graft may be necessary. This involves removing a section from a different bone and applying it to the injured bone. Healing after an injury. As with any injury, there are steps you can take to assist the healing process. Healthy doses of calcium help repair injured areas. Your doctor or a physical therapist can recommend strengthening exercises to be started when enough healing has occurred. For women over 50, estrogen therapy can also aid recovery. Broken bones are one of life's unpleasant consequences. Fortunately, whether you suffer a simple or a compound fracture, proper treatment can usually restore your broken bone to wholeness and health. To find out more information on topics like this, please go to www.north_dakota.healthsourcechiro.com/city/Fargo-Moorhead.